Hey folks, I'm Dr. Amy Pearlman. I'm a board certified urologist with expertise in sexual, hormonal, and genitourinary health. And I have Dr. Brian Steixner here with me today, also a board certified urologist. Brian, say hello to the crew.
Hey guys.
Now, I had a recent conversation with a young man who was telling me about a conversation he had with one of his gym bros. And
Yep.
they were discussing their experience in the past with oral sex with their female partners and how the taste during that experience, if it's not a good taste, will completely eliminate their desire in the future to go down on their partner again. And I think when we think about this conversation, a lot of women might be like, well, that's like rude, or I can't believe someone said that, or I can't believe that can be very offensive for someone not to like how our body tastes.
Yeah.
But obviously that's an important thing. And interestingly, with your company, Popstar, you came up with a supplement that improves the taste of semen. So were you hearing from people that like women didn't like the taste of semen? Like, how did you even get into that supplement?
Yeah, very much so. So you're right. We have Popstar Volume and Taste, which is a total semen health supplement. The primary origin stories of this supplement was born out of my co-founder, Dr. Josh Gonzalez out of Los Angeles, having a population of men who were struggling with anxiety, confidence, pleasure related to semen volume, right? And so they wanted the larger loads. And so when we talked about that originally, we discussed what options they had. And there was nothing on the market that actually made a difference. And so we set out to develop a supplement that could help our patients. When we did that, it started a conversation about total semen health. And so part of our supplement also focused on sperm health, right? We know the rates of infertility in this country are on a rapid rise. 1 in 9 couples will struggle with infertility. Half the time it is the guy. This isn't just a women's issue, like we like to say. Half the times it has to do with the male and sperm health. And so finally we got to the conversation about taste, right? And what we knew is that a lot of men, a lot of women struggle with the taste of their ejaculate. And it's not always it's a noxious taste, right? Sometimes it's a noxious taste that we want to make neutral, and sometimes it's a neutral taste that we want to make better. And so there's not a lot of research on semen taste, right? In fact, I would argue there is close to zero. But there is a lot of research in the biologic literature about the excretion of food sources in various different bodily parts. Think asparagus in your pee. Think garlic in your sweat, right? And so we realized there was an opportunity there. And so what we did is we ran the literature. We did a scientific study to determine all food sources, what was clinically detectable in the sperm, in the semen, and what was positive. And what we found is that 99.9% of things are bad, right? So we're talking meat, we're talking garlic, we're talking onions, we're talking cigarette smoke, alcohol. All these things actually led to noxious or bad tasting semen, which is not good. But there were one
This is
thing.
really fascinating. This might be a way to get men off of tobacco.
Yeah, well, anything to get men off tobacco is a good
Right,
thing, right? Because it's an erection killer.
right.
It's a testosterone killer. It causes cancer. And so as a doctor, one of the things I strive for is my patients to be healthy and having sex when they're in their 80s and 90s, right? Health span as much as lifespan. And so, yeah, I mean, I tell people all the time, smoking is horrible for everyone in every regards.
Were there
But
other items that came up in your search that is bad for semen taste that kind of surprised you?
no, it was the basic ones. You know,
Mhm.
I was more surprised that there weren't more positive things, right? And so we were looking for statistically significant detectable levels of metabolites and derivatives of food sources that could be determined to be positive and exist, right? So like you have to realize that the semen and sperm is a very protected space in the human body, right? The human body does not want the sperm to be accessible for a lot of things that are ingested from the outside world. We need our sperm to be healthy and safe so that we can reproduce. So it's tough to get a lot of stuff in there. But the stuff that is in there, largely negative, related to what we eat. And there was only one thing that we studied that was statistically significantly detectable, and subjectively perceptible. And that was related to pineapples. And so we did realize that if we added the amount of this substance into our supplement, it was the equivalent of eating something like 45 pineapples a day. And so we distilled it down to our supplement. 4 pills a day taken with water is the equivalent of eating 45 pineapples when it comes to the impact on sperm and semen taste.
So that's interesting. So, okay, going back to the research that eventually led you to think about pineapples, it was the research that showed that the whatever that was in the pineapples could get into the semen, or like did that research actually show you that it improved the taste of semen?
Both. And so it was impossible to study the taste of semen objectively, right? There is no way to say, there's no taste bud studies. It's an incredibly subjective thing. It's also impossible to get institutional support to study the ingestion of another human being's bodily fluids. There are safety levels there that an academic institution, an IRB, will not approve, right? So we had to kind of separate it and put it back together. We separated it in the fact that you could do semen analysis and you can do semen studies to determine what is detectable at statistically significant amounts and changeable. And so you can do that with biologic data, right? That data is out there. There's a wealth of information from the food industry about these things, right? There is science related to food sources, what you eat, what you ingest, where it shows up, how it impacts things. This stuff is studied and is big business. We use that literature and that approach to study the semen. The taste changes, they were subjective taste changes. And so we after we developed our formula, we gave our product away and did research studies, questionnaires to determine whether or not it actually worked. And we were happy to report that over 85% of people who took it, their partner actually had a statistically significant increase in their interpretation of semen taste, whether or not that was moving from a noxious taste to a neutral taste, or a neutral taste to a positive taste, and in some situations, taking it from tasting horrible to tasting great.
Wow. So when you say it tastes great, does it taste like pineapple or it just tastes great?
Um, I've never tasted it, so I cannot comment.
In a
Um,
very roundabout way. I'm like,
yeah.
brilliant.
But when we ask this, there is probably a little bit of a placebo effect, so people think it tastes like pineapple. I think largely it tastes sweet to the person who is on the receiving end. And so that perceived taste of sweet, that perceived taste of fructose, that is perceived as a pineapple flavor.
Interesting. So I guess pineapple has a role on pizza and in semen, is what you're
Yeah.
telling
And
me.
you know what? It's probably more controversial when it comes to pizza than it is for semen. I mean, if you ask anyone about what's it, Hawaiian? Is it called Hawaiian pizza, the Hawaiian option? That's a polarizing subject. I will tell you, no one is against better tasting semen or a pineapple flavored semen.
So, we both trained at University of Pennsylvania and have busy clinical practices. I mean, I don't recall the topic of semen taste ever coming up in conversation. And it's interesting because as urologists, when we think about ejaculatory volume, because I believe this supplement also increases volume of semen, we kind of make bad jokes about volume. We routinely put men on alpha blocker medications to help them urinate. And oftentimes they will have then retrograde ejaculation. So either reduce ejaculate volume or they no longer have ejaculate that comes out of the tip of their penis with orgasm. And so often we kind of joke about it. And I've probably said this to a few of my patients before, is it's less of a mess. It's less messy, less cleanup. And we kind of giggle. But that's actually not really funny because for a lot of men, their ejaculatory volume, their antegrade ejaculation is a big part of their sexual experience. So, but in medicine, in our training, we never learned how to teach people how to increase their volume and improve their taste when, like, probably the real everyday people walking down the streets, right? We're both on the East Coast, care about this information. So, what is your message to, let's say, our urology colleagues who might be tuning in? Why should they care too, other than just you and I?
Yeah, when Josh and I developed Popstar, the initial conversation came out of a younger population on the West Coast. A high percentage of them were gay men who were having anxiety and stress related to volume. And when Josh called me, he said, "What do you do for a young guy with low volume?" And full transparency, I said, it doesn't come up for me a lot, but it does come up for me a lot in the older man, let's say 50, 60, 70s, some of them undergoing a sexual reawakening, newly dating, others who are first time on alpha blockers, they're taking their Flomax for the first time, and it has a pretty pronounced and sudden side effect. And I was always shocked how many men cared about this, right? Because women don't care about volume at all. And I used to say, just like you do, if you turn the lights off, no one knows the difference because your erections are the same and your orgasm feels the same, just nothing comes out or less comes out. But there is data out there that men stop their alpha blockers for this because it seems like a very small, unimportant side effect. But the fact that every urologist knows it's the side effect is because it does come up and it does matter, right? If it caused headaches, you wouldn't bring it up to everyone, right? You say, hey, look, you take your Flomax, you may have a slight drop in your blood pressure. If you get lightheaded, maybe stop it. You warn them of that. And then you say the next statement is it's going to decrease the volume of your ejaculate. Those are the two main things that men mention with alpha blockers. But think about for a man who's 65, who's probably not trying to have kids, why are you even bringing it up, right? You're bringing it up because history tells us that it does matter. And so I was seeing these patients who were stopping their alpha blockers, miserable, getting up 5 times a night or going under surgery to treat their prostate because they couldn't take their medicine. And so I said to Josh, I said, Josh, you know what? This may have an application outside of that younger population. And so one of the primary things that we use this for, or we hope it's adapted for, or we see men buying it for, is men who have to be on alpha blockers, who are having volume issues, who are trying to supplement their dietary intake of certain chemicals and certain minerals, and then add hydration to that so that they can increase their pre-ejaculate volume and their semen volume, keeping in mind that 90% of semen is not sperm.
So you just described one population of men who might benefit from this supplement. So it's men who are on alpha blockers, who want to stay on the alpha blockers, but also increase their ejaculatory volume. So I love, that type of patient population. Are there any others that come to mind?
The primary goal of Popstar is fusing science and sexual confidence and positivity. And so we live in this space that is predicated upon science, but focused on the bedroom, right? And so there are a lot of men who have issues that come and see us who have low ejaculate volume for a lot of reasons, right? Neurologic issues, diabetes, high blood pressure, alpha blockers, prostate issues, prior prostate surgeries, prostate radiation. There's a ton of different reasons why men have volume issues. We also have men who just want more volume, right? This is a pleasure thing for them. And what we have realized in being in business for quite some time is that as you increase volume of production, it takes more muscle to expulse this or to ejaculate this. And so what we're finding is that men who take our supplement are having stronger, more powerful, more pleasurable orgasms.
So, Brian, you and I were chatting last week about this product because, like you, I'm a very curious person. And, but also, like you and a lot of our fellow urologists, we hear about nutraceuticals and different supplements. And maybe the first, phrase out of our mouth is, no, it's not FDA approved. It's not regulated. You shouldn't take supplements. And yet we recommend supplements all the time for vitamin D deficiency. Creatine is one of the most well-studied supplements in all of medicine for cognitive function and, muscle recovery. And so we can't just have a blanket statement that says, don't take supplements. So what is important for other urology colleagues or healthcare providers to know about this supplement in particular? Like, what ingredients are in it? Is there anyone who's not a candidate for this supplement? And as a urologist, like, how do you figure out how to make this supplement safe for patients?
Yeah, that's a great question. So when urologists speak to me about our volume and taste supplement or our fertility supplement, I asked them if they ever wrote saw palmetto, right? I asked them if they've ever wrote D-mannose, cranberry extract, or vitamin C for recurrent UTIs in women. And so a lot of them are more familiar with that space, right? When I'm talking to andrologists or infertility doctors, I ask them if they've ever wrote zinc or coenzyme Q or vitamin E for sperm health. And what you find is there is a common conversation that some of these things do have an impact and fit into a total global health space, right? And so I tell most urologists, this isn't a medicine, this isn't a surgery. It's not designed to treat, fix, or cure a disease. It's designed to be a part of your day-to-day routine to promote wellness, right? So adding a supplement like volume and taste for someone who has a perceived issue with their volume or their taste, or for someone who is struggling with it and it's impacting them and they need to focus on this, has to be part of a total wellness routine that includes a good night's sleep, a healthy diet, exercise, decrease stress. When you add supplements to that and maintain a healthy lifestyle, it can have a profound impact on how you feel.
So you had mentioned previously that things like meat and I believe you said alcohol and smoking can make semen have a noxious taste. If someone is still engaging in those behaviors or taking in those substances and they take your supplement, do we know if that can counteract the bad taste, or do they need to be off of those things and take the supplement?
No, I mean, we would be out of business if we told men that they couldn't have a beer or they couldn't eat meat. It just wouldn't work, right? This is about finding a balance in life. I am a big advocate of a healthy eating, and so we want to make sure we use this as a doctor as an opportunity to talk about those things. What you put in your body is medicine, right? And so I use volume and taste when it comes to the taste component to counter an unhealthy diet or to counter a diet that would be perceived as unhealthy towards semen taste.
If a guy has a normal volume ejaculate, but just wants to produce more, can this help him?
Absolutely. I mean, that was the primary goal,
Mhm.
right? And so we know the normal ejaculate volumes based upon studies from the male factor infertility literature. And we know that timing of ejaculation has a huge impact, as well as hydration. And so we have a lot of guys who subjectively perceive themselves as having low volume. We have a lot of guys who have normal volume ejaculates who want more. It's part of the pleasure. And we have guys who perceive that when they take a supplement that increases their volume, they have better orgasms. And so we have a lot of guys who are taking this to enhance sexual pleasure as well as treat issues like low ejaculate volume that is secondary to medicines they're on or medical conditions that they may have.
So I want to go back into this topic of you being a urologist in the nutraceutical business. How do you source the materials? What's in this supplement? Like, what are the added ingredients that are not actually necessarily doing anything for the volume and taste, but need to be in there? How do you kind of figure that out? Can you speak on those issues?
Yeah, absolutely. I think what separates us as a brand and a company from others in the supplement space is the fact that we are founded and developed by physicians, by doctors, specifically urologists and urologists who are focused on sexual medicine, right? We live day to day these issues with our patients, and we're acutely aware of what is going on, what they're looking for, and what solutions are out there. And so being a urologist and developing this means that I had to feel comfortable giving this to a patient in my practice or to present it to colleagues who may be considering it. And so when we developed this, our science that we put into it was perhaps much more rigorous than would be expected from another supplement company. But what I think is absolutely critical as well is the process that we use to source our ingredients, to make our supplement, and then test it for microbiology, for heavy metals, for purity rates is probably the most rigorous of any supplement company that you will find. And so anything that you're getting from us is something that I would feel comfortable giving to a patient, giving to a family member, and knowing that it's going to work and it's going to be safe.
I think one of the top questions that people want to know are like, what are the top 5 foods to improve ejaculatory volume, right?
Yeah.
So, what are the top things that you have in your supplement that improves volume?
Yeah, absolutely. So number one is hydration, right? So on that list, adequate fluid intake is critical. And so we recommend you take Popstar with 16 ounces of water, which allows that support water to get into your system. It actually helps in the supplement as well. The two big things that we have that relate to semen volume and sperm health are zinc and L-arginine, which we know are supportive in the development of sperm, the development of the support nutrients that allow sperm to survive their journey, and some of the enzymes that are involved in breaking down the egg and in that journey for supportive nature. And then Pygeum and lecithin are the two big ones. And the interesting thing is that a lot of this research into semen volume, it didn't exist in the human medicine literature, and it didn't even exist in some of the other biologic literature. It existed in veterinary medicine literature. So some of the origin studies behind this have to do with cattle and horse reproduction on an academic level coming out of big veterinary medicines, big academic institutions, because it's big business, right? And so cattle and horse ejaculate and semen is critical for reproduction. It is critical for the meat industry. And so when we initially started to look at volume, we kept being redirected into a lot of scientific research about semen volume, not in humans. And we could extrapolate a lot of that, but it was the basis for a lot of what we did. And interestingly, when you then looked at chat groups and forums of men who were trying to develop what they call a supplement stack for semen volume, we saw these same things popping up. And so in our infinite wisdom as human beings, men are out there and have been out there for decades using these for this indication, but no one ever bothered to look at the right amount, the right concentration, the right source, because you can get these things in variable amounts in variable locations, right? So you can get lecithin, which has been shown to increase semen volume. You can get it based out of soy, right? You can get it based out of sunflower. And so that opens up a whole different conversation of, is there issues taking soy-based lecithin and the impact on testosterone or estrogen, right? And that's a perceived issue. And sunflower lecithin. And so, one of the things we always wanted is we wanted our product to be based on sunflower lecithin because we think it's cleaner. We think it's better. One of the issues we ran into is that the world source of sunflower lecithin is the Ukraine, right? And so with the conflict in the Ukraine right now, sourcing sunflower lecithin has been complicated. And a lot of brands and products that provide lecithin to the consumer have switched to soy. We haven't. And it does impact how much we charge for this, but we haven't changed our prices because we're rooted in making sure people can get access to the ingredients and the supplements that they need.
I feel like every time I look at a food nutrition label, it has soy lecithin in it. Yeah, it's very interesting that you mentioned that.
Yeah, and I don't know your opinion on soy. I know it's the data is it's inconclusive as to whether soy impact can affect estrogen levels, and for men, whether or not those rising estrogen levels and that testosterone to estrogen balance actually is statistically significant. You could argue it isn't, but we're not willing to take the risk.
Mhm. So you mentioned that people take 4 pills of the supplement a day. What if someone takes 8? Will they get even more volume?
Well, yeah, the bigger thing is we struggled with having to take 4 pills, right? And so one of the things we worried about is that that would be an obstacle for people taking it. And we know that the more pills you have to take or the more frequently you have to take them impacts compliance. That data is out there in the medical literature, right? If someone has to take 1 pill a day versus 2, how well they are compliant with that medicine goes down. But we didn't want to sacrifice how well it works. And so initially we wanted to make a gummy, but the components that make ingredients into a gummy form occupy so much of the volume of that gummy that we would have had to make like 38 gummies to take this. And so we are rooted in science, and so we wanted to take 4 pills. You cannot take 8. The reason why is the literature right now on zinc supplementation puts the upper limit of what you can take somewhere around 40 or 50 milligrams, which is exactly what we have. We do have copper in the supplement as well. One of the risks to taking sustained zinc at a higher level is copper. It lowers your copper level. And so we have to give you copper, but taking more than that could actually put you in a zinc toxicity level.
So someone who's going to be taking your supplement should be looking at the other supplements they're taking. Like if they're taking a multivitamin and it has zinc, then they should probably stop that multivitamin.
Absolutely.
Mhm.
Or in a way, you could reduce the amount of Popstar that you're taking to 50% of it and take two of them, getting a lot of the benefits, but also being able to get the benefits of your other supplement. And if you speak to the supplement world or people who take supplements, this is a conversation that they're aware of, right? A lot of people take a lot of supplements. They'll add powders to their smoothies in the morning, they'll take their supplements in the morning or the evening, and they're aware that not all supplements can be taken together, and there is some synergistic effects of taking multiple supplements.
Mhm. So people take what, 4 pills at a time?
Most of our customers take 4 pills a time because compliance is easier. We do have people who take 2 pills twice a day with 8 ounces of water as well.
Does it matter if they take it with or without food?
We recommend you take it with food. Zinc can cause a little bit of an upset stomach, and so taking it with food will mitigate that problem, although there's no risk of absorption taking it with or without food.
Mhm. And then let's say someone drinks it with 32 ounces of water. Are they going to get better results the better hydrated they are?
Yeah, I mean, I'm a big fan of water, and
I know.
so
I see you just drank some water. I'm thinking you
yeah,
just put down your supplement with it. You just had it under your tongue or
I
something.
should have. No, when it comes to semen ejaculate, more water is better, right? The more hydrated you have, the better you are. Think about if you have a dry mouth, right? You have a dry mouth, you drink water, you're not dehydrated. All of our bodily secretions increase, right? And semen is no different. And so the more hydrated you are, or the least dehydrated you are, the better.
So I want to give people listening, especially if they're healthcare providers and they have patients coming in with concerns about reduced ejaculate, like what's a 30-second elevator pitch or recommendations that we can provide patients who are interested in increasing their volume and or improving their taste?
Yeah, I mean, for sexual medicine specialists, I think it's a conversation that you're not having right now, that you may be surprised how frequently it does bother men, right? And so, the first thing I offer up is ask the question, right? You'll be surprised how many men are struggling with ejaculatory issues, whether or not that's infertility issues, volume issues, taste issues. And so once you begin asking those questions, you'll realize that you can help people, right? And so that's what we're here for. We're here to find the problems that our patients have and provide solutions. And the beauty of Popstar Labs is it's urologist founded, it's physician founded, and we have solutions that are over the counter, available online, available at Amazon. And so you can provide a solution to an issue that patients have that meets their needs.
So what would be like the 5 things that you recommend for improving? So it would be making sure you're hydrated. It
Yeah.
would be considering taking this supplement.
Yep.
It would be if you're drinking, eating a lot of meat, smoking cigarettes, we know that those things are going to make the taste worse. Is there anything else that you found in you've done more research on this than anyone else that I know.
Yeah.
Is there anything else that you found that people should or should not do?
Yeah, I mean, a lot of our data was born out of the male factor and fertility data as well. And so our hydration's key, right? That's key for health as a whole. When it comes to the actual impact on fertility, male factor fertility and sperm health, when it comes to the actual impact on semen volume and semen taste, then taking Popstar Lab supplement is probably the most critical thing that you can do. However, exercise, sleep, de-stress, all of these things will increase your testosterone level, will improve your erections, will improve your mental health, and will make you better. I also recommend, strong interpersonal skills as well with your relationship and your friends. And so all of those things together are critical. Of course, stopping smoking and reduction in alcohol consumption is critical as well. I think we're learning that no amount of alcohol is a safe amount of alcohol. I'll go out on a limb here, but I think the generation that is growing up nowadays will look at alcohol like we look at smoking right now. And so I'm a big advocate of educating my patients on if they're smoking, stopping. I think that's a no-brainer, but limiting the impact of alcohol on their sexual health and their total health. That's a big conversation I'm having in the clinic nowadays.
Mhm. You had mentioned that urologists might be surprised to know that their male patients are thinking about this a lot more than we perhaps give them credit for thinking about it. I had this same exact scenario come up in my clinic. You and I were chatting last week. I literally remember these words coming out of my mouth verbatim. I was like, Brian, I don't really have the patient population who would come into my office and tell me they want to blow a bigger load. And literally, that was like on Friday. And on Monday, I had a new patient come in. He's a successful businessman in Miami. And after I learned about like his medical and surgical history and got like his history of present illness, whatever, I simply sat back and I asked him, "How can I help you have better sex?" And he literally said, "I want you to help me like blow a bigger load." I don't know if he said it in those exact terms. Maybe he said, well, I think he did actually. And I said, "Oh my God, I'm so happy you brought that up because now I can actually give you guidance." Literally, if this guy had said that to me a week prior before you and I spoke, I would have said, maybe drink more water, maybe you're hydrated, or I would have said what probably a lot of urologists say. That's part of getting older. It's really common to have worsening erectile function, takes longer to get erections, time between erections and orgasm is going to increase and ejaculatory volume, decreases. So those are common things that happen. And I probably would have left it at that because I've said that to many men before. So I think it's really fun now. Since that patient on Monday, I've had a couple more patients. Like I had another guy that I had in my notes wants more ejaculatory volume. I didn't address it during the last visit. I saw him this week for follow up and I was like, "Hey, are you still interested in increasing your ejaculate volume?" He was like, "Yeah, absolutely." I was like, "Oh my God, I would love for you to try this supplement." You
Awesome.
know, because so much in this space, right? When we don't have published literature, is as long as it's a safe product, patient feedback is so key. As a woman in men's health, unfortunately, like the one downside to my job is I can't try these supplements myself. So I rely on patient feedback and I'm really excited to hear back from my patients. But even since our discussion like last Friday, now it's a week later, I've recommended this to like 3 of my patients. They are freaking pumped.
Yeah, I mean, you bring up a couple good things. One is what a brilliant question to ask. How can I help you have better sex? I mean, that's the root of what we do, and it's such a beautiful way of putting it out there. And so that's amazing. Second is we actually sent that patient down on Monday. I don't know if you know that was someone we sent to your practice. Just kidding. No, for urologists practicing out there, specifically in the sexual medicine space. I think you'll be shocked to see just how impactful it is to ask these questions, right? I like to think about sex as a total journey with the North Star being the orgasm. So like what can you do leading up to sex to make it better? What can you do during sex to make it better? And in the recovery phase, right? And so that whole journey has a lot of aspects to it. You can ask a lot of questions about that whole journey. What can you do to get better erections? What can you do to get a higher testosterone? What can you do to get bigger loads? What can you do to get healthier sperm? I mean, we have people taking Popstar Volume and Taste prior to sperm banking before they go away in the military, right? And so there's a lot of indications for these things that we don't think about, and they're only going to come up if you start asking the right questions.
Now, you had mentioned you have with Popstar Labs, you have a whole product portfolio, and another product in your portfolio is specifically for semen health for like an infertility product.
Right.
Um, Tell me about that product, why you decided to develop that product. And then a second question is, we oftentimes talk about infertility supplements, like while someone is actively trying to have a child, is to take a supplement. Is there value in a man taking a supplement for just to protect his future fertility without even having a fertility issue?
Yeah, it's an incredibly hot topic. So, um, my wife and I struggled with fertility. And it was a bit humbling to be a sexual medicine doctor, someone who treats patients with infertility, and then to find myself on the other end of the conversation. And when I went through this journey, I found myself being a passive observer, and my wife being actively involved in hormones and shots and retrievals and ultrasounds. And we know 1 in 9 couples, and that number is rapidly changing. 1 in 9 couples struggle with infertility. About half the time, the male is involved, right? And that number is 50% worse than it was 20 years ago. And there is a dystopian scenario where infertility by 2060 is more critical to the survival of our species than global warming or our environment. And so when I was in that moment and my wife was doing so much and I was doing so little, I thought to myself, what can I do? right? And what can I do to make my sperm the healthiest they can be so that we can be successful? And we have two kids now, so it worked. And there wasn't a lot out there that I could do. And so I said to myself, there's got to be a way to be healthier, right? Like we talked about before, diet, exercise, stress, sleep, eliminating smoking, eliminating alcohol, but supplementation has to play a role, right? And if you speak to people who are in the male factor and fertility space, there are supplements that they do recommend. And I wanted to make sure that I was taking the right amount from the right source and in a safe thing if I was putting it in my body. Interestingly, and he allows me to share his journey, my co-founder Josh and his partner are using a surrogate to have a baby, and he is currently undergoing the same journey. And the common thread to all of this is sperm health, right? How do we maximize sperm health? And if you talk to people who are in the male factor and fertility space or andrologists, they have someone who has compromised sperm health. They'll have them donate sperm and bank sperm very early on because things can get worse. That may exist for our species, right? And so people who are 18 right now, who are facing 4 years of college and 4 years of medical school and 5 years of residency and 2 years of fellowship, they have a long journey ahead of them. And we know infertility rates are huge amongst doctors. And so if you're facing a military service, if you're facing a cancer diagnosis, if you're facing chemotherapy or a stressful professional experience, or if you just want to make sure that you're banking your sperm for the future, for 3 months ahead of time, you got to do all the things to keep it safe. And so adding a supplement to that could be critical, as well as taking it around the time of IVF. So we have a lot of people who are using this for variable reasons, but we're seeing a generation now who's in their 18 to 25 range who are super aware of the journey to fertility, the risks to fertility, and the decreasing rates of sex that are happening nowadays in that generation. And so making sure that you have healthy sperm and you have sperm that is banked could be critical for the future.
That was a big conversation that came up kind of on social media related to COVID, a few years ago and sperm health. Let me ask you, is there any downside to a young man taking a fertility supplement, knowing that he's not actively trying to conceive, but just wants to take something that's going to be good for his sperm health? Any downside?
No, no, there's absolutely no downside. We do know that the lifespan of sperm is somewhere around 75 days. And so if you are going to be doing something like, let's say you're going off to the military or you're facing a cancer diagnosis or you want your sperm to be healthier, it will take a good 3 months for this supplement to sort of really kick in. And so, but taking it day to day at age 20 to maximize sperm health is definitely something that's safe for men.
Now, would you have people take both the fertility supplement? Do you call it a fertility or an infertility supplement?
Fertility.
Fertility. Okay.
Called Popstar Fertility for Men. And we are focused on providing a positive environment for all men who are seeking to maximize sperm health, whether or not that's on the infertility journal or just making you more fertile for the future when it may become a bigger issue.
Mm-hmm. So might you have men combine the fertility supplement with the volume and taste supplement?
We don't recommend you do that. No, the reason why is the zinc concentrations and the zinc levels in both supplements could put you into a level where your zinc intake was too high. And so we educate our consumers that if you're taking volume and taste, you're getting enough zinc for the benefit. If you're doing this for a fertility reason primarily, then we recommend the fertility supplement and we do not recommend you combine them.
If someone were taking the fertility supplement, might they notice an increase in volume?
Yeah, of course. I mean, that happens. We know that from the male factor and fertility literature. It's not just about the health of the sperm. It's not about how good they can swim. And it's also about the volume as well. And so we know that the fertility supplement can impact all parameters of a semen analysis study.
Mm-hmm. So I recently interviewed Dr. Mo Kira out of Baylor College of Medicine for a podcast. And I was asking him about the important sort of barometers of a young man's health. And we were talking about erectile function. We were talking about like a semen analysis to assess sperm quality. And, when I asked him, I said, so should we be checking semen analyses and testosterone levels and understanding erectile function and capturing data on young men? Like, what's your thought? Should more young men, even outside of having a problem or a diagnosis, should they know more information about their erectile and semen health?
Well, not only should they, but they're asking for it, right? And so it's humbling to answer that question after Mo answered it because we all know that we are humbled every time we listen to him lecture. He knows everything. Um, I like to say that sexual medicine is the canary in the coal mine for all other medical issues. And so if someone comes into my practice and they have ED, I am very worried about their cardiac health, right? I'm worried about their heart. I'm worried about stroke. I'm worried about their cholesterol, their diabetes, because these can be the first signs that bring a man into a medical practice, right? We know we treat men. Their leg could get chopped off and they'll walk it off, right? But if their erection goes away, they'll go see a doctor. And so sometimes it's the greatest opportunity for us to bring full spectrum medical care to a man. And so anytime someone's coming into our office who has ED, sexual complaints related to testosterone, I use that as an opportunity to educate. Well, now, whether or not doing routine testosterone and semen analysis studies on all men is beneficial or cost effective, I think insurance companies would argue it is not. And so epidemiological studies would probably also argue that it's not. But that's why businesses are being born out of this. I know specifically in my clinic, I have home sperm testing that people can order and do at home. They add a reagent to it, they mail it away, and they get their results. They do have to pay for that, but it's a pretty seamless process. It's relatively inexpensive at around $100 to $150 to know where you stand. And I always say, data can only be used to help you.
Oh, I agree 100%. Data is king and queen. And I think it's an opportunity for young men to be engaged in their health. I think we need to stop telling young men, oh, you're normal, you're within normal limits, come back when there's a problem. And then when they come back and they're 40, 8 years old and now they have problems and we say, why didn't you come in sooner? We did that to them, right? So I think we have to open up this space for healthy young men to say, look, we want to help you optimize your health. Let's get some baseline data so we know if you're 20 years old, what is your testosterone when you're 20? So we know when you're 35 and you have it repeated, whether or not that's high or low for you or normal. So I'm big on the data, just like you are there. Okay, so how would you suggest that a healthcare provider asks their patients if they want to blow a bigger load? Like they're not going to ask that question. I mean, you and I might ask it that way, but would we just ask, are you concerned about ejaculatory volume? Any changes in ejaculatory volume? Are you concerned about the taste of your semen? How do we ask that question?
Yeah, I mean, I think, when I see patients and I'm focused on urology, I'm asking about urologic conditions. And, I have trained myself to ask a certain lineage of questions about urology that take care of all things, right? So I'm asking about the kidneys, kidney stones, blood in the urine, your bladder, your urination, your prostate, cancer screening, and then sexual health. And I go through a litany of them. For primary care doctors, for general practitioners, for family medicine doctors, I think it's part of your review of systems, right? And so as you march through your review of systems and you get to the urology, it's not just about urination, right? We are the genitourinary specialty, but part of that is sexual function. And so when you ask questions about all different aspects of someone's medical care and you get to the urology questions, ask about urination, ask about the bother with, and ask about sexual medicine. I think you'd be surprised how many of your patients are suffering. I do recognize that if I was a primary care doctor and I was dealing with huge prevalence of diabetes and high blood pressure and high cholesterol, cancer screening, vaccines, everything that is on my plate, including trying to navigate an EMR and all the other sides of medicine that we struggle with nowadays, it would be probably the last thing that I would ask, right? It would be it's always a joke that the erection question is when the hand's on the door and you're leaving the room, right? And so there's a reason because our medical system is burdened with a lot of issues. But if you have the time and you have the patient who you think it's an issue, ask about sexual complaints and ask it, Amy, like you do. How can I help you have better sex? It's a beautifully worded question and it opens up the opportunity for a conversation.
to ask you some follow-up questions from some points that you made earlier. I just have a couple more questions for you, Brian. So you said you went down like the Reddit rabbit hole when you were doing your research on supplements. What were some of the common themes? You mentioned that you have people are talking about supplement stacking for ejaculatory volume. Like, what else did you learn from the Reddit rabbit holes?
Yeah, I mean, you can learn anything you want on Reddit. I mean, it is a wealth of information. When we think about the landscape of sexual medicine, as doctors, oftentimes we're limited by the myopic view that we have seeing patients in the office. And we're not always aware of the issues that patients have. And so Reddit opens up the hood to what is really happening in the outside world. Patients sometimes are scared to ask their practitioner questions about certain things. They're not scared to ask Reddit. They're also not scared to offer up things that they are using, right?
Reddit has no fear.
Yeah, Reddit is undefeated. And so I use Reddit as a source of what are people worried about? What are people doing right now to treat that? And understanding the landscape of what is actually happening in sexual wellness. I think the conversations that happen on Reddit today are the big sexual medicine issues in 5 years, right? And so that's what I'm paying attention to. Now,
It's a hypothesis generator. It's essentially taking the place of the retrospective studies that we do.
yeah, it's asking all the questions. You
Mhm.
want to know where the questions are being asked? Reddit. It's out there. And so we use that as a source of, what questions are people asking in the sexual medicine space? When we know there's an issue, we're using it to tailor the questions about what people are struggling with, right? So Popstar just released its delay spray. It's designed to make men last longer, have better sex, and address premature ejaculation or perceived premature ejaculation. And so we needed to know in that space what men were struggling with, right? Was it the consistency of the spray? Was it the strength of the spray? Was it the application of the spray? Is there concerns about discretion? Do they care if it comes in a yellow color or a black color? Should it be hidden? Should it be small? Should it be? There were so many questions that we didn't know that we used Reddit forums to sort of frame the conversation for us as to where to start our research. Then we were able to go into the scientific research, but also some of the pragmatic research about how we deliver the information to the patient or the customer.
Brian, I would venture to say that you know more about pineapple, delay spray, and lubrication than any other urologist that I know.
There's a
What
joke in there somewhere.
there's a joke. Hey, yeah. It's like, and then you go to a bar, and what happens? So
Yeah.
like, okay, so Brian, let's say and obviously you and I don't drink alcohol, but let's say we were at a bar, right? And I was sitting next to you at the bar, and I was like, so Brian, like, what do you know about lubrication? How'd you get into that space? Because I just want to, I know you have like a fairly large product portfolio with Popstar Lab, and you know a lot of lubrication. So, like, what do people need to know about lube? Is
Yeah.
is it complex or is it pretty simple?
Both. So you're right. Popstar Labs developed a semen volume supplement, and all of a sudden, our eyes were open to wow, there is a profound lack of education, high quality products, and awareness for the doctor and the customer. And we looked at it as our mission to educate above anything else, to educate and draw awareness to sexual medicine issues and then solutions. And so after volume and taste and after fertility, we said to ourselves, where is the biggest opportunities, right? Where is the biggest opportunities for us to help? And two things came front of mind. The first is premature ejaculation, and we're happy with our delay spray. We think it's the cleanest, best made, lack of spray, lack of transfer, strongest, best acting delay spray that you could possibly think of. But lube came at the same time. And the reason why we put forward a lube is because we realized how many people were using lubes. And to us, we saw how many lubes were on the market with not a lack of insight and clarity as to what they were, where they were made, how they worked. And we're putting these internally for women, internally for men, and also on the penis. And so if you don't know what you're putting on your body, or what you're putting in your mouth when you eat. Why would you put something inside your body otherwise? And so Josh and I did a deep dive into lubes. And as much as we were sexual medicine doctors,
I
when
would
we
love to see like what's on your Google search, by the way. Sorry, I didn't mean to interrupt.
no, it's actually a reasonable question. We and Amy, I'm not speaking for you, but Josh and I are sexual medicine doctors, and when we started this journey into lube research, we thought we knew enough. And we were quickly humbled into realizing that it's a very complicated conversation, right? And so when we developed our lube, we wanted lubes that were clean. We wanted lubes that were not going to change the pH of the vagina to cause women to have infections or yeast infections. We wanted lubes that were safe, that were not going to cause inflammation or allergic reactions. We wanted lubes that wouldn't stain the sheets or the bed or the clothes. We wanted lubes that lasted long. We wanted lubes that felt good. And we wanted lubes that we knew were made in a safe environment and would be okay to travel with, right? You could put in your carry-on. And so there's so many variables at play that you don't think about when you are saying use lube in the office or telling a patient use lube, or when a consumer goes online and tries to buy a lube, it's overwhelming. And so we tried to consolidate all of those factors, the science, the bundling, the packaging, the production, the manufacturing, the sourcing, and then the way the consumer interacts with the lube to make sure that it worked for the modern day person. So yeah, it's discreet. It's delivered discreetly. You can buy it and it'll come in a black box and no one will know you had lube delivered to your house. It's just small enough that you can carry it in your carry-on and no one will ask you about it. You don't have to check it. So like all of these factors, which you don't think matter outside of the science, really mattered. And so, yeah, we became what I consider to be the world's experts on lube and pineapples.
I've had so many conversations with patients about different sexual wellness products that they've tried, and people kind of love them or they hate them. And we oftentimes say, oh, you don't like lube, then you're going to be one who never likes lube, or you don't like this supplement, or you don't tolerate this, so you're never going to tolerate it, right? And oftentimes it's just maybe the one that they chose that just didn't work well for them. Interestingly, I just had a patient who I had prescribed generic tadalafil for, like, a lot of us, it used to be in the water. And he was tolerating it well. And then the pharmacy was like Walgreens or CVS changed the generic tadalafil company product that they were using. And then he started having side effects. And I've never had this conversation with any of my colleagues that someone could have different side effect profiles depending on the specific generic brand of a medication they're taking. So I ended up sending it to another pharmacy like CVS or Walgreens where they had a different generic and he tolerates that fine. So it's so interesting how there's so much variability and it could just be one single added ingredient in a product that helps someone either tolerate it, not tolerate it, or love or hate a product.
Yeah, absolutely. I mean, we experienced that in the compounding world when we saw men using compounded testosterone and the gamma irradiation process of sterility that was involved in it. Something never crossed my mind is how do they sterilize injectable medicines, and can that sterilization process actually impact success or risks of infection? And so something that we pride ourselves on is after our product is made and we're about to bring it to the patient, to the consumer, and we think all the hard work is done, we still have another step, and that's testing it, right? And so one of the things that's critical is we test all our products for microbiology, for hard metals, for purity. We test every single time we run a batch and we file it and check it and make sure it's perfect, or we don't use it. And so every single time you use our products, you're getting the same thing, which is critical for us.
So your mind is probably constantly racing and you're a curious and creative person. What is next for Popstar Labs?
Yeah, there's a lot, right? We look at Popstar as the better orgasm company. And we look at our company right now as a personal intimacy and sexual wellness brand for men. And there's a lot we can do. There's a lot we can do in the erection space. There's a lot we can do in the testosterone space. There's a lot we can do in the recovery space. And so we are looking at 5 or 6 new products this year, which will elevate and address specific issues that sexual wellness doctors deal with, that patients are talking about on Reddit. And we also are considering a female line, right? And so with a female line comes a whole different pace. We take that very seriously. And so we're working with experts in the OBGYN space, in the sexual wellness space. We are working with women professionals to lead this conversation. And so sexual wellness is the future. We are excited about being the best brand out there, providing real solutions that are driven by real professionals. And so I wish I had 48 hours in a day because there's so much we can do. And, Amy, it's teaming up with people like you who are driving this conversation, who are living this conversation, who get us excited to bring more and more solutions, who we're looking to partner with for trouble that they're having. Where are your pain points in the office? And how do we find a solution if it does exist? And when we do that, how do we deliver the message in a way that is correct?
Mhm. How did the name Popstar Labs come about?
Well, we have an absolutely brilliant branding guy who co-founded our company, Jordan Goldenberg, out of Los Angeles, originally out of Philadelphia. So he was living in Philadelphia when I was at the University of Pennsylvania, and we became friends. And Jordan is a master at branding. He has brought companies to Shark Tank. He has brought lots of products to the market, and he just has an eye and he knows what to call things. And we spent a lot of time on it. We had clinical names for it, which were like nerdy and clinical, and I thought were amazing. But Jordan said, no, stop for a second, right? We need to have a product line that looks cool on the nightstand, that looks cool in the bathroom, that people are proud to take, that takes sexual wellness, provides solutions, but makes it awesome, makes it fun, makes it empowering. And so Popstar sort of fit the mold, right? Everyone wants to be a pop star. Everyone wants to be a legend, right? But also, the pop, the ejaculation, the orgasm, it just felt so perfect. But I give all the credit to Jordan Goldenberg for that.
Well, thank you for sharing that. I think in my clinic, my patients tend to like everything being sort of discreet. And I'm like, I'm trying to like change this narrative to where if a man is seen in my clinic, that's like should be a badge of honor. Like, heck yeah, I see Pearlman. And so other people know, damn, that guy's probably having like great sex.
Hey,
So if someone's using like a pop star product, like I bet his semen tastes great. I bet he has like has a lot of volume. I bet that guy is healthy and good in bed, right? That's kind of like the vision and the mission.
yeah, I mean, I think the world needs to catch up with us. And I think it will, right? I think we are ahead of the curve, ahead of the wave. But that's where we need to be because it needs people like you who are there for them. There's a lot of people struggling in the dark, right? There's a lot of people struggling in communities where they don't have access to care, in geographic areas where they don't have access to care. And so bringing the conversation to the masses has to be the first part of awareness, and then backing it up with real professionals and real solutions. But I'm with you, right? I draw analogies to counseling, right? Men used to say, I don't want to see a counselor. I don't want to see a therapist. There's nothing wrong with me. The conversation in the world of counseling is changing as well. It's a badge of honor to say, I see a therapist and I feel better because of it. If I could send all my patients to Dr. Amy Pearlman, all my customers to Dr. Amy Pearlman and say, see her, you will be better because of it, this whole world would be a better place. So I hope you're right. I hope the decade that we're in is changing the conversation about sex. I hope it's cool people like you that are reframing the conversation to make it mainstream and make it normal. And I hope my brand supports you.
Oh my gosh. Well, thank you for those very kind words. Brian, where can people find out more about you, your clinical practice, and your product portfolio with Popstar?
Yeah, you can find Popstar online at popstarlabs.com. You can find us on Amazon, and you can find us on all social media handles at @popstarlabs.
Awesome. Brian, it's always so great chatting with you. Thank you so much for your time today.
Amy, you're amazing. Thank you.